Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? I'm Dr. Sajan, and this is the Plastic Surgeon Podcast. Welcome to the Plastic Surgeon Podcast, where we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. I'm Dr. Sajan, and today we are so excited to have Dr. Alexandra Kohles. Alexandra is a physician. She's going to share her amazing story with us of plastic surgery and revision plastic surgery. Alexandra, welcome to the show today, and we're so happy to have you.
Thank you very much for inviting me.
She is one of my patients. She's an amazing person. I've had the privilege of getting to know her. We're going to talk about her story today. To give you all an overview, Alexandra had surgery when she was 26 in Chile. Then she moved to America, got married, and she came to me for revision surgery that we'll chat about. I did 2 revision surgeries for her. Today we're going to understand her motivations, her why, and gain a lot of information from her experience. So Alexandra, I remember when we were chatting earlier, you told me you had breast augmentation done in Chile and when you were about 26 years old. Is that right?
Yes. So to put it in context, and why did I do the surgery back then when I was 26? It was I have 2 more sisters. I'm the middle child, and if you see my sisters, I have one that looks like Salma Hayek, and the other one looks like Sofia Vergara. So I grew up with that. Very voluptuous, gorgeous women, and I was more into the petite and more athletic kind of built in. And it was not an issue when I was in high school. I think I was confident enough. It was later in life when I had a long relationship with someone, and I think that person transferred his insecurities to me.
You really? What insecurities did he have?
So he was a very how can I say this? He was very handsome for Latin American standards, and I think he wanted. I think in a way, I think I challenged him intellectually. So I think that in a way, it was. I cannot say in order not to say something bad about someone. But
say what you're comfortable.
Yeah. Well, the thing is that I think it was a very long relationship, and I think
how long was it?
For 6 years.
Oh wow!
So it was almost when I was almost done with my med school.
Okay, so you met him in college, and then the relationship.
I met him
continued.
in college, and the thing is that because med school in Chile is 7 years, and most of the other careers are 5, he was done and working.
What did he do?
He studied business. So he used to. Well, he started. I think he's still in the financial business. I think.
Are you still in touch?
No, I'm not. But the thing is that I think that he wanted to be this very handsome and kind of a womanizer kind of guy. He was. So I have never been that way. In order, I think that aesthetically, a woman should look their best. But I think that also you have to embrace your own personal characteristics. And I think that I was confident enough with the way I was built and the way I dressed. But for example, and I think that all women have suffered this at some point with not the right person that you have, and not and also in not the right time. I was very stressed in med school, as you might know.
Yeah.
And you're going through a phase where your studies are more important than probably the way you look. And I think that he was on a different stage in his life where he wanted everything to be perfect. He was very... So, for example, if I was if we were going out and I tried to look my best, there's always, he would say, you look beautiful, but. You see?
Do you think he was focusing on what wasn't right instead of what was right?
Yeah, but I also at the same time, I think that it was his own insecurities.
Like, what would he say? Would he say like, "Oh, your breasts don't fit right, your makeup is off"?
He would tell me like he would like it if I had more breasts.
He would say that.
Oh yeah.
How would he say that? How do you tell that to someone?
He would say, for example, if we were going to the beach and I was wearing some sort of swimsuit, and I would notice that he was looking around to people who had, females who had more breast. You see?
And you would ask him, "What are you looking at?" or something like that.
No, I wouldn't. That's the thing with me. I would acknowledge it, but because I was so confident in myself, it didn't bother me.
So how would he say it? He would just randomly tell you?
Oh yeah. Very honestly. And the thing is that I think...
you say honestly. Do you think that was mean or malicious, or was it honest?
I don't think it was malicious. I think that it was the way probably he was raised. Because you also have to see the background where these comments come from. And I never took it personally until he broke up with me, you see. And then when they break your heart, then you start looking at the history that you had with that partner, and then you're saying, because you feel like, what else could I have done? But then in introspective, it's not what I could have done, is this was not the right person for me.
And you say background, do you mean that's how his family was?
I think culturally. Culturally, men...
and this was in Chile?
This is in Chile. I think Latin American men expect a certain type of women, like body shaped, and probably that you have to dress up, that you have to put makeup, and women also. I think it's built in the culture. I think not anymore though. I see it now with my nieces that live there, and everything is shifting for the good of womanhood. Yes. I think. But also, for example, and this is what it. The difference, I think, between Latin American culture and this toxic masculinity is that it is spoken. It is out there. Women know about it. When I moved here to the States, everything was like, oh, no, we're not that way. Men are... But then you are the only country... this is the thing. My country elected twice a women president. You see? We do have CEOs in our companies who are female. In here, you don't, or it's a minimum, you see? So I think that in here, it's not out there yet, though.
Yeah, I know what you mean. And I think things have changed a lot with more of the hidden culture coming to light, especially with the recent political things.
Yes.
Now, you were in medical school, and this gentleman broke up with you. Was it in your last year of medical school, or were you done?
It was when I was entering residency.
Okay.
Which, we call it internship, which is 2 years but it's basically residence.
And did he break up with you for a reason? Did he tell you, I'm not happy with your shape or your look?
No, I think that he broke up with me because this is what happens. I think he wanted to, because this was a long relationship, and I think he wanted to be with other women probably before he settled. Because after the year he came, he tried to reach out to me, you see.
Did he ever cheat on you or hit you?
Well, later on in life, I knew that he was. No, he never hit me. No, it was not that kind of relationship. I think he did everything. I think he had a double... I wouldn't say a double life, but I think that what he showed me, it was different of what he was actually doing.
So he was a cheater.
He was a cheater. Okay. Oh, yeah.
And then you were done with him. He came back, probably came groveling back, missing you.
Well, I don't know if he came crawling, but then, so in the year where all of this was up, he broke up with me, and then in that year, I made my husband. So when he returned, I was dating my husband.
Yeah.
So.
And then when did you start thinking about having you had your first surgery was a breast augmentation in Chile?
So it was right after we broke up, because I was, as you know, they break your heart, is your first love. It's and you're in your 20s where everything is more idyllic, you see. And then I decided, you know what, I think that it's time for me to get this surgery. I was not happy with my breast, but I think that this gave it a little push. And also I said, I'm 26. Nothing is going to change it. I'm very athletic, and I do a lot of go to the gym and stay in order to stay healthy. And this was not something that will do it.
Did your family know you were going to have this then, or were you keeping it really quiet?
No, my family was very supportive.
That's awesome. Your mom, dad, and your sisters?
Yeah, my mom and dad, they say, but why, if you're so beautiful? Kind of like they couldn't understand it until I told them that I was trying to fill the void that I had for a long time. But also, I wanted to change my body. I wanted to reinvent myself. It was more than just having big breasts. It had to do with the image I wanted to see in the mirror and to lift my self-esteem.
And you had the surgery done?
Yes.
How did you find your doctor there?
So my doctor, I found it because he was one of the doctors that was doing, he was a plastic surgeon who was the chief of the burn unit in one of the hospitals that I rotated.
And you asked around, people said good things, I'm sure?
Oh, yeah. So I had a friend of mine that did a surgery with him, and she was super happy with the results. And so I said, okay, so probably this is the guy that I should go and see.
Did she have a breast augmentation by him?
She did have a breast augmentation, yes.
Okay. And then you went for surgery with him. How was your consultation?
So my consultation was probably like with every plastic surgery. He had his office. It was spotless, and his team was great. And he said, "Yeah, let's do it. If you truly know what you want." And he said, "But just to let you know, because of your frame," he said, "I can put a lot of kind of like, let's not go overboard, and I won't do it." Okay. So that kind of like that comment that he said, it was like, okay, he's not trying to do a bad job. He's trying to make me aware that this would look good on me because of my proportions. So he was looking at my case. He was not just doing it because everybody else was getting huge, big implants.
Do you remember how much it cost to have breast augmentation?
Back then, probably around $5,000
And did you get saline or silicone? Do you remember?
No, I got silicone. But back then, and this is, well, now we know it, it was the rugged implant.
The textured
one, because it just came out. And he said to me, well, and this might have less problems with encapsulation. Yeah. Now we know that probably that's not it. But yeah.
And a lot of doctors about 20 years ago were doing those kinds of implants, round textured implants. They were putting the implants in above the muscle, which is the way you had it done. Yes. And he put it in through, did he go through your areola or through the fold?
No, he went underneath the breast. Okay. Yeah. Yes.
And how did that surgery go for you?
It went well, although and I think that it was my left side, I had to have antibiotics at the post-op.
Did they give you antibiotics before surgery?
Yes, okay. They did. But then I had I think one of the stitches got an infection, so he gave me oral for afterwards.
Did you have oral before surgery?
No. Okay. I just had the antibiotics on surgery. Okay. But also in those days, he would put a drainage. So I had,
drain tube.
A drain tube, yes.
Oh, wow. So the way we do breast augmentation now, the way I do it at least, is there's never drains. The reason we don't do drains now, and I know you know a lot of this because you're a physician, is because drains increase the risk of encapsulation. They increase the risk of infection. They cause an extra scar site where the drain comes out of. The other thing that we do now is we start patients on antibiotics the day before surgery, and I keep them on them for at least 7 days. And that's been shown to help decrease the rate of infection in our practice and also encapsulation. The surgery went smooth for you. How was your recovery?
It was fast. I was doing my daily activities probably 2 weeks after that.
Mm-hmm.
And everything went great.
How was the pain?
The pain, well, I'm very good with pain. So I don't know if I can be like the standard patient. So it was exactly the same as with you.
Yeah.
There was no like unbearable pain going through. So
And when implants are placed, they can be placed in one of two positions. You can either put them above the muscle or below the muscle. The way most high volume breast augmentation surgeons do it now is below the muscle. The reason you do it below the muscle is many. First, you get a lower risk of sagging long term. Number two, you get a lower risk of capsular contracture. Now, it depends on the studies you look at. Capsular contracture above the muscle can be up to 25%. Below the muscle, 7-8%, and even lower than that. So the convention now for most high volume people is to go below the muscle. Now, textured implants are controversial. Back in the day, the textured was used because many people were putting implants above the muscle like your doctor did. It was a popular method. The problem with that texturing was, in some people now, it caused a weird kind of lymphoma picture called ALCL. So it caused that reaction, and some women got that form of cancer that had to be surgically treated, sometimes even chemotherapy. The other issue with that old texturing was they noted that it broke down and caused a ton of issues in the body. Now there's different kind of texturing that people do that's safer and it's usually put below the muscle. The other issue with the implants 20 years ago is that silicone that was in that textured shell, oftentimes it was liquid. So what that would mean is that silicone would go through that textured shell and get absorbed into the bloodstream. The silicone used now is solid silicone, so you don't get that absorption.
Yeah. So so back then, and this is it, I'm telling you, this was 20 years ago. All of the techniques the technique that he did, it was in order for it to look more natural. It was the technique that most of the plastic surgeons, at least in Latin America, were doing.
Yeah.
And then I think that the implant was just coming out. So it was something new that they wanted to try it. And there was, the studies show that it was less of a risk of encapsulation. But I did got encapsulated.
Yeah.
So.
But everything you said is absolutely right. You know, during my training, Alexandra, I want to get your opinion on this.
Yeah.
People who train me often said, when something new comes out, you don't want to be the first, you don't want to be the last, but you want to be in the middle. You want to let everybody else get the bugs worked out. What do you think about that?
I think that is the safest way to go. Because you don't want to be the guinea pig on innovation, but you don't want to stop innovation. So that being said, I think that, and this is for your viewers too, in my experience, see medicine as not something that it's written on stone. We are always finding new things. We're always researching. There's a lot of studies done for things. And one thing that could have been great at one moment, it will not be as time goes by and more studies are done. You see?
You're so right. The pendulum swings. And with breast augmentation,
exactly.
The biggest example is going below or above the muscle. Back in the day, everybody was going above the muscle. Now, most high volume people all go below the muscle. Total change in paradigm. And even with like nose jobs. Back in the day, it was all closed. Now it's all open. And now the pendulum is shifting back to all closed. So it's such a diverse practice. You know, medicine is a combination of art and science. I think you would agree with me on that.
I agree totally with you. I think that, and just for people who are not on the field, just look at it as something that is continuously changing, and it's changing in order to improve, not to make it worse. You see, but also I think that in plastic surgery there's so many new techniques that they were not available. There's so many new, for example, in my days, Botox was not a thing. And even fillers were not a thing. And now you don't have to go and get augmentations or wrinkles out of your face. You don't need a facelift. You see, you don't have to be on the OR. And that is a big improvement.
Absolutely. Alexandra, after surgery, were things different? How did you feel?
Well, after surgery, it was a great procedure. I went back to my internship, like rotation-wise, and I had no problems whatsoever. And in the self-esteem department, I think that it was funny because I think I had a very good self-esteem. But after I think I got my breast augmentation, I really felt like a woman, because I think that probably subconsciously I was feeling a little bit like the eternal teenage girl and not completely a woman. And then also I think that what I realized is that I became a woman, and because I had this relationship back then that diminished a little bit of my self-esteem, I think with this was a new body.
Did people notice it around you? Did they think you were dressing different or acting different?
Not dressing differently, because I have been, I had my style since high school probably. But I think that probably the way I approached the world was a little bit more confident. And I don't know if this was because then I was single and I was not in a relationship, but I got approached more often. So that also boosted my self-esteem, I think.
And you ended up meeting your husband, getting married. Was that after the surgery you met him, or was it?
So it was almost a year after the surgery when I met him, and I met him in Brazil. So my husband never saw me with my previous body, as I call it. We always have talks about this, and he says that he would have fallen in love regardless. I have a different opinion. I think that the woman that he met was a more improved woman. So I think that probably I think I never regret anything I do in life, and this was one of the things that I would never regret it.
Why do you say improved?
Because I think that psychologically, and I think that there's a maturity when you make such a life-changing decision in your life. I think that you can own it. I think that this is, for example, when you also have the decision of what career do I want to do, or the big change of should I move to a different country? You see, and I think that having a plastic surgery, regardless of the other decisions that you have made in your life, you should put it on this department, on a big decision, because it is going to change the way you approach the world.
And how did it change the way you approach the world?
I think that it made me more confident as a woman. It made me also realize that we shouldn't be judging people for how they look, or if they want to change something on their bodies.
Did it make you more accepting of people, you think?
I think I'm hoping that I am a very empathic person, because I went to medicine for that, in order to help people and try to help them in any way I could. But also I think that how can I say this? I think people have, and I'm going to go through women specifically, because that's the thing I know. I think we're very hard on ourselves. We're very hard on, sometimes we're not smart enough. We don't feel like our bodies are the way that they should be. I think culturally, and in every culture, there's a sense that you have to be on a base of a standard. And I think that plastic surgery is a great ally for us. I think that if you really need to change something, make the decision and do it, and it will change your life, because as a woman that we have so minuses in this world, I think that it gives us a plus.
It sounds to me that you may be implying or inferring that the surgery helped you feel more in control of your body. Would that be right?
Yes, in a way it was. I was in control of my body transforming into a woman. You see, I think that I always felt again like I was not transitioning from being a teenager to womanhood. You see, and especially in a culture where voluptuous women are what men want, what other women want. It's in my culture.
You met your husband. You got married in Brazil.
No, we got married in Chile.
Okay.
So so this is the thing. I was not looking for a husband. I was, after that relationship, I was determined. We're focusing on my career. That was, and when I met my husband, he's not going to like this, but I thought of him as a summer fling, to be very honest. It didn't turn out that way. When he came back, he was working in Brazil and it was his last year, and he said, you know what, I need to return to the States. So he returned here, and then because he met me, he took a leave of absence and he dated me for a year. So
what was different about him that made you feel this was more than a summer fling?
Well, because he took a leave of absence and just went to Chile to date me.
Did he treat you different than other men?
I think he treated me different from my last relationship. Yes, he was.
Was he the next serious relationship after that last one?
So yeah, well, so I had a big relationship in high school. To be very honest, he's not going to like this. I regret not having dated more men. Before I married.
Okay.
Before I married.
Okay.
Just to, because I had, two boyfriends before my husband, and they were long relationships. You see, they lasted forever. So, so he likes that. I think that I should have dated more. Yeah, probably. I'm not saying a lot of men, but probably more than 2 men before I met him.
Why?
Because I think it makes you see different personalities, meet different people. Probably, and I shouldn't say dated. Probably I should have had more time with myself and my girlfriends. Or you see, I think I had a long periods of time with someone.
Got it.
Grow independently. Yes.
And then you met your husband. You guys were together for about a year.
So we dated a year, and then I said to him, okay, so I wasted almost 6 years with this person. I said, I'm not getting any younger. And I said, and you are from a different country. So after this dating, this has been wonderful. I love you, but if we're not serious, then we need to call it quits.
What were you looking for to make it serious?
Getting married. I was 28 by then. Yeah. So I married for 28, 27, more or less. And I didn't want to be wasting time, to be very honest. I was not young, and I wanted to have kids. And then he said, yeah, you shouldn't worry. And he proposed there, and he had the ring and everything. So yeah.
That's awesome.
Oh, yeah.
Did he have the ring ready during that same conversation, or was it something he did after the fact?
No, he had it ready.
He knew what you were thinking.
I think he knew from the he told me one time that he knew from the beginning, like from the 3 months that we were dating, that he was ready. I was the one. He was just waiting for me to challenge him in some way. That's
an amazing story. And then you were married. You moved to America with him. You had 2 kids, right? Yeah.
So I finished my my med school, and I worked there for a while. And
What kind of position were you there?
a general practitioner. So in Chile, it's a little bit different than in here because you go 7 years of med school. You go immediately knowing that you want to be a doctor. So it's 7 years, and then you either go immediately to your specialty, which is like the residence that you have here, which is 3 more years, and then if you want, you can do a subspecialty, and then it's 2 more years, and so on. Or you can get points, what it's called, in order to get into the specialty that you wanted. For example, if you were out of med school and your grades didn't match, or your letters of recommendation didn't match, you could go to the service public system and go further from the big cities and do like rural or be a GP on a small town, and then you return because you gave that service, and then you return and you can get into a specialty that you want. And most doctors do that. Most of my friends did it that way.
Did you do that?
No, because I was already married and I knew that we were coming to the States. So I said to Jeff, okay, and we have decided he already had a career over here, and I was beginning. And in those days, my focus was I wanted to be a mom. I was already 30 and the clock was ticking and all the things that, as a physician that can go wrong.
Sure.
Yeah.
But you moved here. Is that when you had your kids?
Yes.
Okay. And you have two amazing children right now, a boy
Yes.
and a girl, right?
A boy and a girl. The girl is 13 and the boy is just turned 10.
And you started noticing some differences with your breasts, some hardening. Is that correct?
Yes, it was. So I think that they started, so I had Nadia and then I breastfed her. Thank goodness I could do that. And then after that, after I got in shape and everything, I felt that they were a little bit hardened. It was not that bad. It didn't hurt. It hurt a little, but it was not as, it was a bearable pain. And I thought, okay, that's probably this is normal. And then when my second child pregnancy, and then I breastfed him, then it was when it started. I think the encapsulation got into a degree where it was painful back then.
So when we talk about encapsulation, we're talking about capsular contracture. Some people also call that rejection of the implant. So whenever a woman has an implant in her body, the body responds to that implant by making a capsule or a thin scar layer that holds the implant in place. When you get encapsulation or capsular contracture, what happens is that gets very thick, it gets very hard, it can get very painful, and it gives almost a deformed look because the body is squeezing that implant. Now, we don't really know why exactly capsular contracture can happen. The most recent data that we have, some of the most recent studies show it could be due to bacteria getting on the implant, and that bacteria causes a chronic inflammation. And that inflammation causes the body to wall off the implant. The other reason people can get encapsulation, especially with older implants, is because they have silicone leaking. When you have silicone that's leaking through the implant, the body doesn't like that. It wants to wall off that silicone, and it makes a hard capsule. Now, if you leave this alone, it can cause problems. If there's leaking silicone, it can get into your bloodstream and cause all kinds of issues. If your encapsulation is causing a deformity and pain, it can limit your movement. It can give you potentially permanent disfigurement of the breast because things are squeezing and getting moved higher and higher, and your body's making that scar thicker and thicker. So that's what capsular contracture is. There's a lot of treatments for it. This can be a 2-hour discussion. But the most common treatment is revision surgery, right?
Yes. So, and this is the thing. I knew that I needed the revision. Was that once I started getting the pain and you could tell that the implants were not on the position that they were at the beginning. Mm-hmm. I said, you know what? We need to revise this. And actually, I called my plastic surgery who did and he said, yeah, you can come to Chile and we can do it. Mm-hmm. That was not an issue. But then I started, my husband said, well, but I don't want you to have it over there because we live here. Kind of like it was more of a logistic kind of thing. Mm-hmm. And then I started, okay, I need to research for what plastic surgeon should do my revision.
And I know you live a little bit south of Seattle.
Yes, I live in wonderful Gig Harbor.
Yes, beautiful area.
Oh, yeah.
So nice. And I remember when I met you, you told me you looked around quite a bit. And then you had another consult, at least one, before meeting me.
So you were the third one.
Okay.
The third is the charm, we call it. So I had one. So I went and did, because this time around I thought, you know what, I should do a thorough research. Like all of the amazing doctors that we have had over here. And I said, well, I'm going to look in my area and see if there's a doctor that I might like. So then I'm closer to home.
Mm-hmm.
But I didn't have a very good experience with the doctor.
I'm not asking you specifics, just so people know. And you're a physician, so you have even more insight, I think, than most people. But when you say not a good experience, can you give us a couple of things of what that means?
So this is the thing. So the physician first, he was not, and this is going to sound horrible, but I looked at his scrubs, and his scrubs were in very bad shape. And I think that you have to look the part, especially on plastic surgery, which is all about aesthetics. So that was one of the red flags. And then the other thing is that his story was that he was moving from California. And he didn't look a lot like a California kind of physician. And then we went into this office. It was in a medical center, so he didn't have his own office. So then I thought, and then the other flag, it was that he said, I can take your insurance and we can do it through insurance. And I was like, okay, well, if you want to do that, but I bet that the insurance company won't give you the approval. But the insurance company did give him the approval. So it was kind of sketchy.
Things weren't adding up.
Yeah. And then I went to one plastic surgeon that had in Bellevue that had done a breast implants on one of my friends. And he was great. His office was great. But there was something missing. And the missing, I always say, is that he didn't have the empathy that you had. It was because that, I think, and this is not because I want to praise you, but I think that you do have a way of making you feel that you're going to go beyond your means in order for you to have the best results that you can provide me. Mm-hmm. And I think you're welcome. And so I was in between the doctor in Bellevue and you, but then when you said to me, you know what, we're going to do the best, and if it's not what you want, we can do it again, like with no cost. And it's not that I was looking for a cheap take on this, but it made me realize, okay, he really backs up his work. This is a great physician, and this is not something that you encounter frequently. Mm-hmm. And I appreciate that, because I think that that's the way we should all be.
Yeah. Whenever I do a revision surgery, especially, I stand behind until the end. If I do surgery for somebody, we're friends till you're healed. And we had a hiccup.
Exactly.
We had a little hiccup with yours. We'll talk about that.
Oh yeah.
So you decided to have surgery with me.
Yeah.
And then our surgery was to do bilateral or both sides breast augmentation revision. We were going to switch the implants out to new smooth implants. We were going to switch the plane of the implants to below the muscle, and that was that surgery. You also had abdominal scar revision that we were going to work on too.
Oh yeah.
Which is another whole story.
That's a whole story.
Yes, we'll focus on the breast for now. Yeah. So then you came for my consult. You had the pre-op. We did surgery. How did that surgery go? How did it feel?
So that surgery was a little bit more painful than I expected it, but also it was because there was so much going on there. So you had to take the implants and then do a different pocket and so on.
So your surgery was really, I remember it was one of the more challenging ones because the capsule you had was so hard and so firm. And when you switch out the pocket, it sounds easy. Well, just take the implant out from above the muscle and put it below. It's very challenging
No,
because
it's not.
yeah, you have to take out that shell between the gland and the muscle, and then you got to make sure that those layers stick together, and they were apart for 20 years, right?
Oh, yeah.
So you got to make sure they stick together without getting a blood or fluid in that space. And then you got to make a new space underneath the muscle and then make it all add up. So it took several hours, but it went well, and we got it done. It's always more painful to go below the muscle.
Yeah.
Always.
Yeah.
So we did that for you, and then you had your recovery.
Yes, I had my recovery, and I have to say this too. It's not just you who is great. I think that your team is fantastic. From your nurses to your receptionist, everybody is on board and everybody is on the same page. So, and that makes your practice so fabulous.
Thank you. You were doing well. You healed well from that surgery.
Yes.
And when I did your surgery, your right breast had the real encapsulation. So we really focused on that. We took care of both. But then we had a hiccup from the surgery.
Yes.
Tell me what happened.
So the left breast, I don't know why.
And that was the more normal breast. That
Yeah.
was the breast that was least troubled. The right one was the one that was more troubled before surgery.
Exactly. So everything was great. Everything was healing. But then around 6 or 7 months post-op, the left breast didn't want to go down, like didn't want to drop, like you call it. So it remained. There was a difference between the right one looked more natural than the left one. Mm-hmm. And actually, if to the touch, also it was a little bit. I think that it had created a little bit of capsular contracture.
It was firmer.
Not as bad as the one that I had, but it was not a soft dropping. And actually, aesthetically, they didn't look the same.
No. It was she had a new capsular contracture now on the left side, and now it was below the muscle.
Yes.
So then we chatted about it. We decided to do a revision. My plan was to remove the capsule that had formed on that left side, to use a special dissolvable surgical mesh to act as a spacer to prevent it from coming back, and put a new implant in. Why did you decide to have that revision and not just let it be?
So I was I was already in my 40s, and as a physician, after your 40s, well, there's two trains of medicine here, but in order for you to have your mammograph, you start either when you're 40, on your decade of 40, or you start on your decade of 50s. And I was looking at myself, and I said to myself, okay, so if I need to be doing this annually, which is a mammogram, I want it to be I want, if they detect anything, to be as easier for whoever is taking my mammogram in order to see anything that is bad. So I follow my advice of, let's do it now before it's too late. Mm-hmm. So my thinking was, okay, so I'm a woman. I'm always going to be a woman. My breasts are there. And now is the time and age where I should be super diligent on my mammograms. And also, one of the things that I like that my breast implants now are underneath my muscle is that the gland is free for this exam to be performed in its more accurate
Correct.
type.
When implants are above the muscle, mammography is much harder and not as predictable. So we went into the third revision.
Yes.
Was that painful?
No, actually, this time around, it has been the easiest, I think, of all the revisions that we have gone through. After a week, it felt like it was a month. I had not very little bruising. Actually, I don't think that it was that swollen even. And because I'm very good with pain, I didn't even have to take like the big painkillers at all.
Why do you think you didn't lose trust in me after you had a complication with your second revision?
Because I think that, first of all, you have been doing it for a while now, which is a plus. But also you are young enough in order for you to innovate. And then the third and most important thing, I think that you have established a great practice here I'm telling you, every employee that you have. And most of all, I think that you back up your job. And I think that
did you feel I did that with your...
Oh, yes. And I think that you are... that what I like about you is that you want to learn from your mistakes, which is not something that you usually find in surgeons. And I'm telling this because I know the personality of a surgeon. So I think that you have both of medicine. I think that you have the empathy of a family medicine doctor and the techniques and drive and focus of a surgeon.
Thank you. And the rate of getting a contracture in a revision breast augmentation is about 25%. So before surgery, we knew even if we did everything right, there was a 1 in 4, 1 in 5 chance of it not being 100% successful. And that was after that first revision. Yes. I did. We did another revision. Now the chance for success isn't that high, but we used mesh and we took many precautions to prevent it. How are you feeling now after that third revision?
I feel that finally I think I got the breast that I wanted and needed. I think that I'm hopeful that I don't have to do another revision, but if that is the case, that I have to do it in the long run, I think it was worth it.
If your daughter said, I want breast augmentation now, what would you tell her?
That I will support her in anything that she wants to do in life, to be very honest. And this is not just with plastic surgery. But I think that if she wants to change something from her body, I'm hoping that she feels confident enough to talk to me about it so we can do our research, find the best surgeon for her. Although probably I will bring her to you. But she has to make up her mind.
Of course.
So I think that is because it's a very personal decision. You have to feel comfortable with the procedure itself. Why are you doing it? Who is performing it? Where are you doing it too?
If you could go back, would you still have done the breast augmentation?
Yes.
Originally?
I think that, yeah, but I think that, and when I look back, I think that if I had done it when I was 19, for example, I might have regretted that I did it that young. I think that 26 was the right age where I knew myself, I knew what I wanted. I was not doing it for anybody but myself. And I think that comes from maturity. There's nothing else in the world that can give you that. Because I think that most of the people also, they need to realize that when you make the decision of changing something from your body that is bothering you, please do it because of you, not because you want to please somebody else with your aesthetics.
I see that so often. Whenever someone does surgery for somebody else, they will never be happy. I do a lot of mommy makeovers. When the women come, and I see the partner sort of dictating what to do or what they should get, it's never a happy ending. But when the woman comes for a mommy makeover and she does it because she feels it's right and she has supportive support, not just support saying do it, much happier in the long run, and we get a smoother journey.
Yeah, I think every decision in life, not just your plastic surgery, I think that every decision in life, if you do it because it's something that you want to do, it's the right decision, no matter what the decision that you're making. But if you're doing it because you want to please someone else, because you want to show something, or because or there's other motives to do it, you are never going to be happy.
I really agree with another thing you said earlier about not having regrets. Now, I believe life happens the way it does for a reason and a purpose, and you make something out of that. But if you look back at your experience now, would you do anything differently?
Yes, I think that what I would have done is a little bit more research on my part, in the sense not that I didn't trust my plastic surgeon, but I think that it was not the right plastic surgeon for my breast implant. For example, my plastic surgeon was a great surgeon that was doing burn people, and he's great at doing that. I think that probably he was beginning to do breast implants, or he was not giving him 100% on that. And then the other thing is that, and I think that it has changed in Chile now, but in those days, the surgeons they didn't have their own clinics, so they own ORs like you do in Linwood. What they do is that they get benefits on a hospital. So when I did my plastic surgery, it was an OR on a hospital, which probably that makes it more risky for infections. You see? True. So if you're researching for a plastic surgery, and this is for the Latin American viewers that you have, or see if you can get a plastic surgeon that has its own OR.
I agree with you.
And not doing it. I think that I think that would be my regret, sort of. But I wouldn't change the whole path because I wouldn't be meeting you. So.
Thank you. There's a lot of data on that, actually, looking at infection rates at an ambulatory surgical center versus an inpatient hospital. And you're absolutely right. The infection rates are lower. Yeah. Almost always.
Well, in Chile, it changed. Kind of like 10 years ago now, I think it was that my friends that live in Chile and they have gone through plastic surgeons because we're aging. The plastic surgeons are now on, they have their own ORs, you see? They shifted that. Mm-hmm. So.
Your story is absolutely amazing and remarkable. Is there any other advice you would give to anybody else who's thinking about having this done, or somebody who's thinking about having a revision?
I think that for somebody who wants a breast augmentation, I think that make a list of the pros and cons first. See if you are willing to go into a little bit of pain that goes with it, and also into the sense of changing your body forever. Because once you get a breast implant, well, you can take them out, but then your breasts won't come back as they used to when you didn't have them. And then for people who need a revision, I would tell them that don't feel bad if you have to have a revision. It's not something that you did bad, or sometimes it's not even something that the surgeon did. Sometimes your body will try to reject the implant in some sort of way. So it's expected. So
the not feeling bad, what you said is so true. So I do a lot of revision surgery, and it never occurred to me till patients started telling me about why they didn't go back to their original doctor or do it sooner. The number one reason, I felt bad. I felt ashamed. I felt stupid.
Exactly. And it has nothing, it's out of your control. That's what I would say. It's out of your control, and it's something that if you have breast implants might happen. There's lucky percentage of people that they don't have to do a revision ever. But there's also a percentage that they will have to do it. And if you have to do it, just go do your research once again. See if the surgeon is good for you.
Makes sense. Thank you, Alexandra. Thank you so much for being our guest today. I have learned a lot from you and your experience, and I hope your ordeal teaches our listeners how and what to expect as they start their own journey for cosmetic surgery. I appreciate you, your story, your time, and I'm honored to have you as a good patient, confidant, and friend. Thanks for listening to the Plastic Surgeon Podcast, and tune in next week for my amazing guest who had gender-affirming surgery, also known as transgender surgery. Look forward to hearing from you on next week's podcast, and catch us on all social media at Real Dr. Seattle. Bam, what?